very exciting. We're going to get into more of that and why we should consider
so
it.
So men above the age of 40 should go for hormonal tests and get the hormonal levels right and see if it's related to the hormones. Because sometimes they don't feel that depressed. They just feel very tired. They have all the symptoms of depression. And when you do these tests, amazing, the cortisol level is sky high and testosterone is low, and if they don't understand this is caused by stress, they get so scared and afraid because they think now their sexuality is challenged. Partly it is, but that can be remedied with treatment. So this is interesting how these two hormones control the sexuality. And some of the symptoms that you want to know, and this is the time, the term we use is going through andropause for these men, and they have, number one, unexplained irritability and anger, worry and tension, frustration. They have a very demanding nature, poor girls. They are sadness, impatient, and they show anxiety symptoms, very aggressive and unloving and withdrawn behavior and depression. Actually, the wives or the girls usually bring these men to us for the aggression and the temper that's not getting well. The men never really agree that they have a temper. It's usually the wife or the kids present. So the aggression is a big part. They think it's part of being macho. So even moods are presented different in sexes.
Well, you see, now this is something that we need to talk about. We need to talk about this irritable man and whether or not the concept of irritable male syndrome actually exists. Grumpy old men, I actually nearly pulled this out on someone this weekend. Do you know why they call them grumpy old men? Do you know why they make movies about grumpy old men? Because old men are grumpy. So why are they grumpy? That's one of the questions we're going to ask. Okay. We're also going to get to, firstly, how we can deal with these emotions. If it is your emotions, if you're beginning to feel that your mood swings are getting in the way of your relationships or getting in the way of your work, just distracting you in some way. And then, of course, as I said, some tips for the ladies or for the children, for that matter.
Great.
So if it's someone in your family and you want to learn to read their moods and you want to learn how to respond appropriately so that you don't get your head taken off, give us a call. 011-883-0702, 021-446-0567. Of course, if you just want to tell us the story about how incredibly frustrating it is living with a moody man, we welcome those as well. In fact, we definitely welcome those. 18 minutes past 8 o'clock. Dr. Shabir Jeeva in studio with us. We are looking at men and their moods, why men experience mood swings, when in life it happens, and what to do about it. VJ is on the line. Hello, VJ.
Hi, good evening.
Evening.
I've just been diagnosed as an ADHD, and I want to know how that affects my moods.
Well, in ADHD, the main presentation, if they are untreated in adults, 10% will get into antisocial behavior, 35% will become anxious, 40% will become depressed. So that's how one of the ways they present, and the untreated 50% will get into substance abuse, and about 15% will comorbid with bipolar disorder. But in the earlier years, about 70% of the ADHD kids and adolescents have a concurrent opposition defiant disorder. And that's the same thing of the moods that we are talking today. They are stubborn, they're difficult, they're belligerent, they're obstreperous, they refuse to listen, they're very sensitive. So the depression is a very big part of ADHD, and the stubbornness and temper and opposition defiant disorder. This is the main reason why these young adults or adolescents get thrown out of school, and these kids. So it's not the bad marks or the bad grades, it's the behavior at school. And opposition defiant disorder is usually missed in the treatment in these kids, and it does magic. We tell these kids we're going to take out the vinegar and put in the honey, or the Boer kids take out the acai and put in henang, and they love that, and actually it works like magic. So depression is a very big part of the treatment.
And what kind of treatment is available for us?
Well, there's a holistic treatment together, which is the main treatment in the world, is exercise, high protein diet, meditation, staying away from stimulants like tea, coffee, Coke, Red Bull, chocolate, and even the drugs and alcohol. Then there's medications, because in ADHD there's a low level of dopamine, which is for focusing, and there's a low level of noradrenaline, which is for impulsivity. The serotonin is not a big problem, but so you need antidepressants that will work on the dopamine and the norepinephrine, noradrenaline, not the serotonin antidepressants, but the most widely used antidepressants that are used in the world are the serotonin medications like Prozac and Xylof and Cipralex and those medications. They don't help very much in ADHD. They are the lowest on the totem pole, but they use the highest. They are the first choice by most family doctors, and that's why many patients are not getting well. So it's very important to understand that.
Well, Vijay is asking about attention deficit hyperactivity disorder and its effect on mood. And of course, it has a huge effect on mood. But earlier, when we were chatting about what causes these moods, how many times is there an underlying condition? And how many times? So at what point do we worry and say you need to go and see your doctor? And at what point is it just a moody man?
Okay, basically in psychiatry, whenever there's a disorder, and what does that mean? If there's any condition, anxiety, mood swings, depression, when it affects your lifestyle, it prevents you from achieving your goal. Many of us have these traits of anxiety or depression or sadness, but when it affects your lifestyle, when it affects your work, your relationship at home, your marriage, or socially, those are the three things in adults. In young adults or children, when it affects your school work, when it affects your home life and your friends, then you have to treat them because then it becomes a disorder.
Okay. So those are things to look out for at that stage. Nikki's in Morningside. Nikki, a very good evening to you.
Good evening.
Hi.
My experience with men and moods, a lot of the time it's a perception of a situation that they have a stored memory of, and they react to a perception as opposed to what's happening. So normally what happens, if a man doesn't feel respect from whoever is around him, be it friends, family, co-workers, whatever, he normally goes to a place where he goes back to a triggered memory, and then he just switches off. And a lot of men become moody because they actually don't even want to listen to the current situation or what's going on. Then that normally antagonizes the woman, who then shouts and screams, and then they don't listen at all. And with the ADHD, I'm ADHD, with the ADHD, we what I call highly emotional beings. And what my experience with men in that situation is that this causes amazing family stress and dysfunctional relationships because they actually shut off from the world to protect themselves because they actually don't want to go there. It's easier not to.
Well,
and it's to learn life skills to help you through to be able to understand who you are and actually turn it around.
Nikki, this is obviously something that you've thought about quite a lot, and you've obviously dealt with quite a few men. It's all very well to say learn life skills, but for any of us as adults to change the way we think is incredibly difficult. And for, as you say, men who have this perception, or rather this history, they're going back on their history all the time. That is unbelievably difficult to change around.
Yeah, you have to do work on yourself. I work with a program that helps people actually manage these kind of things because normally it's not something that's happening now. It's something triggered from childhood, and you have to do work on yourself. As we get older, that is when we need to really open up, and actually you need to be the authentic you, really. And unfortunately, a lot of people don't manage to do that, and that's the problem. And they live with a traumatic event that they had in their childhood or their parents divorcing, and it actually influences their whole life. When you look at a child, for the first 6 years, the subconscious mind is being programmed. Now, what happens if that subconscious mind isn't programmed what we perceive as normally? And that's what people deal with. And it can be a nasty experience at school, but where the person, especially with ADHD, where you're called you're stupid or you're this or you're that, and that child gets destroyed, and that's in the adult. Somewhere there's a cellular memory telling him that he's not going to manage, he's not going to cope. But the face that you show to the world is not necessarily what you're feeling inside. There's a mask. We're all great at wearing masks, so we manipulate and distort the true self, trying to create a different picture. You know?
I agree with you, Nikki, and certainly we're not only talking about men here. This is everybody with this memory and things that we take from our childhood. And certainly I am a firm believer. They say that, if someone shouts at you, is nasty to you, or just acts out in any way, it's generally got very little to do with you and a whole lot to do with them and what they're going through. But let's put it to the doc. Dr. Jeeva, what Nikki is saying about, a memory triggering an emotion, a mood?
Yeah, that's very important, especially if as she mentioned, some traumatic events, and also very interesting that she mentions about respect, because it's according to the literature, love is very important amongst females, and respect among males. And I suppose each spouse should learn how to deal with the other. Actually, my adult patients, in the final, when the war starts, I actually tell one partner to tell the other, how should you talk to each other when you have certain problems? If you're angry with me, how should you tell me? If you're happy with me, how should you tell me? Where should you tell me? Equip me with everything, because a typical ADHD patient will say the right thing at the wrong place, or the wrong thing at the right place, and it just comes out wrong. So you should equip each other, and you can work on each other. And so respect somehow to men is equally important in women too, but somehow the love and being nurtured and cared for in females is slightly more important, and the guys are taking time to recover and withdraw and get back into some action in solving things, and this they feel a bit alienated or a bit abandoned, and this is where relationship and trust comes into the issue.